back to my channel for today's video. This video is part of my therapy series where I discuss all things psychotherapy, from what you can expect to different modalities to how to get the most out of your therapy sessions. Today I'm going to be focusing on another methodology that's gained a lot of popularity and use over the last few years, DBT. And I just know that I'm going to trip up over the full title during this video, so bear with me, we're going to see how it goes. Dialectical behavior therapy, and I'm actually really proud I got that on the first try, I'm not even going to lie to you, or DBT as it's more commonly called, was developed by Marcia M. Lineham, a US psychology researcher in the late 80s. DBT was originally created to treat people with borderline personality disorder, or BPD. People with BPD struggle to regulate their emotions, and their social environment can end up validating maladaptive behaviors. So it was essential to try and create a therapeutic approach to support these clients to improve emotional regulation and develop healthy coping alternatives. Before DBT, there weren't many options available to therapists trying to help people with BPD. It's considered by some to be the third wave of cognitive behavioral therapy, or more commonly known as CBT, and adapts many components of that modality. If you're unfamiliar with CBT or want to learn more about it, I actually have a video of that in this series already, and I'll link it in the description box below. The D in DBT, dialectic, means a synthesis or integration of opposites. In DBT, dialectical strategies help you get unstuck from extreme positions and create balance in therapy. It can be used in group therapy, individually, or recently has actually expanded to include phone coaching in between sessions. One of the good things about DBT is its flexibility and widespread accessibility for clients. It's a modality designed to teach you about the triggers that lead you to react, and then how to cope appropriately to those situations. And while DBT was originally created for people with BPD, its use has expanded to include treating ADHD, bipolar disorder, eating disorders, generalized anxiety, major depression, OCD, PTSD, and addiction. The main skills taught in DBT are mindfulness, distress tolerance, interpersonal effectiveness, and emotion regulation. So mindfulness has grown rapidly over the last few years. I've even talked before about the fact that it's now being included in CBT as well. It's something that almost all mental health practitioners are using more and more to help their clients. Mindfulness is something of a buzzword now. We read it, hear it, and see it everywhere. But it's not just meditation. In fact, most of it has nothing to do with meditation. Mindfulness is simply the practice of being fully aware and present in the moment. Your therapist will teach you how to pay attention to your internal experience, your thoughts, feelings, bodily sensations, and impulses. It's about pausing and turning your focus inward. And mindfulness also utilizes your physical senses, so your sight, hearing, touch, smell, and taste, to consciously tune into your surroundings. In mindfulness, it's just about observing the present moment, both within and without. You're not responding to your thoughts or making judgments about what you see around you. Oftentimes, this technique is referred to as grounding. A common grounding technique you can use is the 5-4-3-2-1 technique, or the census technique. In this technique, you start looking for 5 things that you can see, and you want to be looking for small details. Then 4 things you can feel, noticing the different sensations or the physical qualities of something you're touching. 3 things you can hear, particularly focusing on sounds that your mind automatically tends to tune out, such as a clock or distant traffic. Next, focus on 2 things that you can smell. And finally, 1 thing that you can taste, which can be made easier by carrying gum or small snacks with you. But mindfulness helps you slow down not just your mind, but your body. Mindfulness can be as simple as focusing on your breathing. As we know, anxiety or stress affects your physical well-being. This can create a sort of feedback loop with your thoughts and emotions, as they're all interconnected. By slowing down and focusing on the present moment, you're able to avoid engaging in negative thoughts or acting impulsively. So distress tolerance is all about acceptance, and this is where this modality differs from a lot of other approaches to mental health treatment. Many focus on changing distressing events or circumstances, rather than accepting, finding meaning for, and tolerating that distress. DBT teaches you to accept yourself and the situation as it currently is. And these techniques prepare you for intense emotions and empower you to cope with a better long-term view. It's natural development from DBT mindfulness skills that's about learning to bear pain. In DBT, your therapist will teach you healthy coping behaviors such as distractions, improving the moment, self-soothing, and actively practicing acceptance. Instead of becoming overwhelmed or hiding from the impact of a negative situation, the goal is to calmly recognize them and decide how to respond. Interpersonal effectiveness is essentially how to ask for what you want and say no, while maintaining self-respect and healthy relationships with others. Your therapist will help you to become more assertive and develop communication strategies to help you connect with others more effectively. You'll work on issues surrounding boundaries and your beliefs about your own self-worth. It's the balance between the needs of others and your own needs in healthy relationships. And emotion regulation skills are based on the theory that intense emotions are a conditioned response to distressing experiences. Emotion regulation is about learning to identify, name, and change your emotions. When you could recognize your intense negative emotions, such as anger, and cope with it, it does two things. One, it reduces your emotional vulnerability. And two, it helps you have a more positive emotional experiences. In emotion regulation, the client is able to incorporate mindfulness skills into their current emotions to hopefully result in a calmer, appropriate response to a situation. Often, a useful technique taught to individuals with BPD for emotion regulation is to take opposite action. In this technique, you identify how you're feeling and do the opposite. So for example, if you're feeling sad and want to isolate, you would intentionally make plans to connect with someone you care about. An important aspect of DBT is the role of your therapist. DBT is a very collaborative, strength-based approach. Your therapist will provide support, validation, and teach you new skills. And together you'll analyze problems and replace them with healthy alternatives, as well as working on changing helpful thoughts or beliefs. So how effective is it? Research has shown that DBT can be an effective treatment across age, sexual orientation, gender identity, and race or ethnicity. Most of the research surrounding DBT has focused on its use for people with borderline personality disorder and suicidality, but what research in other areas that we do have shows it is promising for PTSD, depression, and anxiety. And there you have it, dialectical behavior therapy 2 for 2. What it is, how it works, and what it's useful for. If you found this video helpful, be sure to give it a like. If you want to learn more about therapy or other types of treatment, be sure to check out the other videos in this therapy series here on my channel. I also make videos on social work, mental health, and pop culture reviews, so make sure you're subscribed and have that bell button turned on so you don't miss any of those when they come out. Take care, y'all. Should stop editing myself here. Has been included